Perfect. Okay. Well, let's get started. So, hi everyone. For those of you who don't know me, my name is Samantha Dolan. I'm a program officer at the Gates Foundation, and I am going to do my best to host this call today, both making sure everyone can be admitted into the Zoom room, watching the chat for questions, and going through the slides. I'll put a copy of the slides, both in English and French, in the chat shortly for those of you who want to follow along on your own time. I'll just say that we're really excited to start this webinar series for planning for sample registration systems for mortality monitoring. This will be the first of our monthly webinar series where each month we will have different topics that we will cover. The idea is that we're hoping to both provide a venue for explaining new tools, providing new resources, as well as a venue for any discussions, questions that you might want to ask about this type of work, and really getting hopefully to know one another as best we can in a virtual environment. I will say that this webinar series is completely open to the public. Please feel free to forward this webinar link to anyone you know who'd be interested in this topic. We will be, like I said, recording and then sharing those recordings so that anyone who is not part of who's not actively planning a sample registration system but is interested in doing that has the ability to access all of these resources. I will say, with that in mind, most of our work is going to be devoted to how to plan for a sample registration system, but there might be tidbits in there for those of you who work in countries that already have a sample registration system, or those of you who are further down the line in mortality surveillance. There still might be interesting tools that could be useful for thinking through what a more integrated system looks like. So I'll just put a plug in for that. And so this is a wide audience, but we do hope it can serve to kind of help us better coordinate and work together in this area and really to create a better community for strengthening mortality surveillance overall. Great. And so this is just my welcome slide. I think I've covered most of these topics already. But I will just stress that, and I'll say this again at the end of the call, we do want to hear from you. We want to hear about what topics would be interesting to you for us to cover, what your experience has been, whether that's with planning or whether that's with implementation. But I think that's really what's going to be most valuable for these sessions is when we stop talking, the presenters and the facilitators, and start hearing from you. So we do want to leave at least 10 minutes at the end today for that. And in the future, we can have longer webinars just devoted to kind of questions and sharing that come up. But with that, I think, and for the sake of time, I'm going to hand it over to my colleagues. We're going to have three presenters today, Dr. Agbessi, Dr. Daniel, and Dr. Malick, who are all going to help us better understand what we can be doing to help plan for an SRS using a situational assessment. So without further ado, Agbessi, I'm going to hand it over to you.
Yes, thanks, Sam, and good morning, good afternoon, everyone. I hope you can hear me well.
Sorry, Agbessi, I'm so sorry to interrupt. One more thing that I forgot to mention to everyone. If you need translation services into French, please see the interpretation button on your Zoom screen and switch it over to French. If you also, need to do that for English as well, just in order for us all to be able to hear everything. Okay, and with that, Agbessi, sorry, now over to you.
Thanks. Some mentioned, this is open to the public and to all countries that are planning or implementing or about to launch a sample registration systems. However, we are also specifically targeting those countries that have received grants that to do the planning of the SRS. And so some of the tools we put together we'll expect them to use those. But also, we also understand that some countries are at different level. Some are already ahead on the planning, and so the goal here it's not to get you to restart, but to readapt, to adapt and take the tools or the processes based on where you are currently. So the overall goal, as we was laid out earlier, was to develop a government-owned sample registration system. So we want the sample registration system to be led by the country, owned by the government and stakeholders, and so that it can be sustained and used to improve the understanding of mortality rate and disease burden. Across a representative sample of the populations. Next slide, please. So in terms of the scope of work, what your mind or which we are targeting will give you a short slide summary of what you have in your planning, and then we jump onto the tools. Next slide. So as you plan this SRS, there are a number of objectives that we have to keep in mind. And these are listed here, the 6 objectives here, or the outcome we want to achieve ultimately. As first is to establish this population representative sample registration system, SRS, that is functioning. And along that, we want to improve the digitization and interoperability of mortality data collections through the SRS, integrate the SRS with other surveillance systems existing in the countries, enhance this birth and death registration, also civil registration and vital statistics. All this also linked to the need to understand the landscape of mortality surveillance in the country and link the SRS to this, or understand and the role that the SRS will play within that landscape. Developing a strategy for ongoing monitoring of the sample registration system. And we want to do all this also by improving the CRVS system that is on the ground. This is supposed to be complementary and enhance the vital statistic system in the country. Next slide. So to do the SRS, we start by doing a planning of activities. The planning activities, which is the grant that some of you have now, must include a number of activities that we listed here. Now, this would need to be adapted to your country situation or the way it's structured, but we'd like to see these, at least, no matter how you adapt it, implemented, included in some way. So the first will be to do an assessment of the existing mortality data sources and stakeholders in the country. We need to have a clear understanding of the landscape for mortality systems. What are the systems that are there? How are they functioning? How can they respond to the need for mortality and causes of death, representative mortality and cause of death? We need to keep an eye on the design of an SRS, whether national or subnational, to produce representative data on vital statistics. The planning grant should end on a costed plan for future implementation of the SRS. So it's the end of the planning. You will not have an SRS, but you have at least a well-developed and budgeted plan for an SRS that can be implemented for the next 4 years at least. It needs to identify in-country partners and funders that will support these initiatives in the long term, develop a total formation of coalitions within the country, and engaging the stakeholders in the country that have interest in sustaining this SRS, and building that coalition is important for the long-term success of the SRS. We want to engage the local expertise and understanding of the implementation context. And finally, a clear strategy of using the data that you will generate through the SRS to inform the public health decision making. Next slide. So keeping these activities in mind, we'll expect you to deliver on these 4 items at the end of your planning grant. The first is the situation assessment report. So that's the objective of today's webinar, which is focused on tools that you use to plan to do the assessment. We want to have a complete proposal for an SRS. If you are about to launch an SRS, assuming that's what you're planning for countries that are already implementing an SRS, that's it's not relevant here. We'd like to see a costed strategic plan, action plan, and ultimately you'll be able to present all your plan to stakeholders in the country and get a full buy-in of them. So we'd like to see these 4 at the end of the planning grant. Next slide. Now, going back to the first item, which consists of implementing an assessment, a landscape assessment of mortality systems in the country. We've drafted some tools, I should say, to support this activity. Now, countries are different in terms of stakeholders, structures, and how they would like to go about this. These tools are put forward for you to adapt to your current situation. If you have already started the assessment, the goal is to see, look through the tool, see what you have not been collecting or what you need to collect in addition, so that we all have the similar data set as we conduct this assessment. So we'll share some tools and some analytical approaches today. We'll not have time to go through everything. We'll be available for you to reach out to us directly if you have specific questions. Additional tool will be shared, and we'll go along next month as well. Next slide. So going to the specific objective of the landscape of the mortality assessment, which is, again, as I mentioned, part of the overall planning of the SRS. There are two objectives here. First is to understand the existing system of the mortality landscape, of the mortality data landscape in the country. This will involve understanding who are the key stakeholders, what data are being collected, at what level, in terms of geography, and how these are contributing to informing the public health programs in the countries, and including
échantillage par échantillage.
to each other, including to the national civil registration systems. The second objective here, as you do this, is to keep an eye on the fact that ultimately we want to develop the sample registration system in the country. And so the evidence you're gathering here must inform the design and successful implementation of the SRS within the countries. Next slide. A number of specific objectives, and this, you could still adapt at the country level within your country, depending on your the structure that you have in the country or what already exists. But we'd like you to get a total understanding of the main stakeholders of mortality and cause-specific mortality data in the country. What level of decision making they are in and what their roles are. And the third objective here is how mortality surveillance system operate. Well, what are the complexity, the inefficiencies, and the challenges in the systems? We want to understand the linkages between them, interoperability, and how information flow across. What tools and form they use for data to collect data, at what level of granularities, whether individuals aggregate, etc. And the sixth, we want to know how these systems or initiative of data collection are producing their data, but how good are those data? In terms of the geographic coverage, the representativeness, data quality, and so on, how are they being used? Are they useful for a particular area or not? A thorough understanding of that. We want to understand, identify, and describe experiences in the use of digital tools, because many of the system now are taking advantage of the rapid increase of information technology using a mobile phone for data collections. We want to better understand that. We want to map the information architecture of mortality data in the countries and ultimately summarize this, not only by developing a thorough understanding of the landscape mortality data, but also how this contribute to a design of an SRS in the country, and how an SRS also can contribute to improving this initiative in the country. Next slide, please. So we share 4 documents. The first is an outline of what you'll take as a protocol for planning, for doing the assessment. It includes the procedures, the process that you'll go through, data that need to be collected, etc. So we like you to use that as a document that you can improve on to start your assessment if you haven't started already, or incorporate the element into your assessment if you have already started. Then data collection tools involve first an inventory of the systems in the existing data system, data initiatives in the country. There's another tool will involve direct interviews with key stakeholders. That include, first, we had a plan to interview leaders, planners, those who have authority in decision making with regard to mortality data collection and monitoring and evaluations in the country, so that we can better understand the priorities for an SRS, the priority for mortality, and the funding available. Another tool that will directly collect information from managers of systems that exist, that was specifically better designed to understand data flow, data, how the human resources is organized, how data are organized and transferred, what type of data collected, and so on. So these tools collect more specific data. Additional tool that will be shared later will help on how to better analyze the information that is collected. Next slide. So this is I'll hand over to Malick to walk you through quickly the method of assessment, in how you use this tool or what these tools are, and then Daniel will come in. Thanks. Over to you, Malick.
Thank you, Agbessi. So yeah, as Agbessi mentioned here, we have developed several tools that the country can adapt based on their need. So first, we want you to start with a desk review of existing tools. So we have shared the form for the countries to fill to help them identify some groups and tools that already and mortality data that already exist in countries. So, and that will help them to see whether those are national levels or subnational level, and also help them identify the main stakeholder for mortality data collections, who's doing the analysis, and so also how the data has been used. So this is mainly based on the desk review that country must do before they go for primary data collection. After they have this table filled and know overall data that exists in country, there might be some gap that was not published, and we want them to reach out to the institution that implement those surveillance or data collection related to mortality. So there we have two tools, as we mentioned earlier. The first, we did want to really separate those two tools to make sure that when you talk to the leadership, it's mostly understanding the existing plan, what are the source of fundings, the vision of the country for mortality surveillance. Then we want also you to talk with the technician, the managers, really to understand specific details of how the system is really working, the interoperability, the data flows, who's collecting the data, resources that they need, data sharings and all that kind of things. And also there are additional tools that may help you also after you have all the data collection to really do some consultation with stakeholders, or also organize a workshop with stakeholders to share results, and that might also help you for all the stakeholder to understand where you are and what you collected was their vision of the system, and also bring them together to really understand what you are doing and support the system, and that might be also buying for the country. Next slide. Yes, so here we list like the key systems that might exist in many countries, and also who are the key respondents of those systems. For instance, you can think about the decision makers. The respondent might be Minister of Health, or the government health services, and other departments from the Minister of Health or other ministries. When you talked about the civil registration, you can think about the managers at national and provincial level, and even go through the district level to really understand what's going on in each of those districts, and also including some of those directors and from the vital statistics. And because, you know, those two, civil registration and vital statistics are really linked together for them to collect the data and do the analysis and publish the results, mostly the statistics office. And also the HMIS, the routine system that exists in most of the countries. You can think about directors from the Ministry of Health, the MNEs, at national, regional level, and also go through the subnational level to really understand how the system works. The surveys that most of them collect also mortality data, mostly the National Statistics Office, and also the Public Health Institute that might do some survey to collect those type of data. You should think about them. If country have like the maternal and perinatal death surveillance and responses, you should think about those kind of systems and to meet with the implementers. to really understand how the system works. Some countries also might have some burial surveillance or morgue system that also help to know also all the systems that collect data in the country. Few countries have HDSS, Health and Demographic Surveillance System, that have been there and collect a lot of data on mortality, causes of death, other things. So it's important to also include those institutions that have a long experience of collecting this type of data. Even though it is really limited, the geographic area is really limited, but they have the experience working in this type of system and might be really useful for you to understand data collection, analysis, and publication. Communities, if some country use like community workers to collect data, or village chief, what type of tools they have to collect like births, deaths, and how they transfer the data. All those things should be in your also design of the system. And also think about the other partners like the UN agencies, some NGOs that might provide some fundings, but also for data use and analysis. They are like a technical partner and they really support most of the system, and really useful also to think about those and what tools should be useful for them. So that's why we have different tools. Next slide. So here, when you do your desk review, you might think about systems that exist in country, and this table can be adapted through your work and see what you need there. But this table helps you really to understand mortality surveillance that exists or mortality platform that exists in the country. Then you can see all those boxes give you some ideas from the desk review how you can fill it. Like we give you just here an examples of a CRVS that this is mostly from Mozambique probably, and who is the managing institutions, and also key other partners that are involved in the systems, where the geographic scopes, and what type of data they are collecting, and also how the data is aggregated, like at individual or community level. Those kind of things should be there. And also what is the level of data collection. And also, as we mentioned here, country has started to use a lot of digital tools. It's important to know whether the system is digitalized, fully digitalized, partial, and also try to get also some contact person to start when you want to go for deep an understanding of the system, because the desk review might not provide you all the information, and you might go to meet with people and interview them and get more information. So you can put some contact person from the desk review, or if you know it. So yeah, this first form called Form 1 will help you to design the desk review, what type of information you need from there before you start the next phase of data collection. Next. As we mentioned, there are two tools. The first is about the stakeholder. Now, depending on your data collection, you can see how you want to organize your data collection. But we really want to make sure that you understand the two tools have some similarities, but also some differences, because depending on who's responding to the questionnaire, the stakeholder is mostly at the senior level. So to make sure that we understand the role and the priority of the country, so all of them start with like an identification of the respondent, what is his role in the institution, and what the institution has been doing, and what are the priority for the mortality surveillance, and also understand a little bit about the dissemination of those data, but mostly focusing on also the policies, the law that exists in countries, and also the governance and the sustainability of the system. So about fundings, and who's governing the system. As you can see in the tool, this is mostly like an open-ended questionnaire that really collect a lot of qualitative data that will be used later really to understand the country, where they are, and the vision for the country for an SRS, how they are seeing an SRS in the country. So this is mostly for the stakeholder. This is really high level. Next slide will go mostly to the technique, what we call manager or coordinator of the system, like the technician that really work on the system. So again, you have two. The first is still identifying the system, the respondent, and all this, but also start thinking about the data production. Who's collecting the data? What type of data they collect, who's supporting the data collection. All those are also included in this tool that we share. And the other section will talk more about the digital solution that exists in country, whether they use like the system that exists and what type of adaptation has been done in the country before they use the system, what resources they have to implement the electronic systems. And also the next section will talk more about the data analysis and reporting to understand what tools the country have been using to analyze the data, what type of indicator they calculate, how frequently they report those data about data, and also before that about the data quality management. The data quality and data management also have been included in that tool to really understand the strengths of each institution of supporting the system, and also the weakness, and those are also included in this questionnaire. And also the reporting, how frequently they report the data, whether it is annual report, and how they whether it is quarterly report, and how they report also the data for use. And also we add here one section related to the funding. What are the funding opportunities, who's supporting the system, and if there are also additional funding that the country think the institute think they will receive in the near future for supporting the system. And we wanted also to add just a question here related to referral, because from the desk review, you might get most of the system that exists in country, but you want to ask them if they know some institute that have been running this type of system in the country. Then if they know someone that we can contact, then you can go back to your list of the planning tools that the first form there, and see whether you have this right person and the right system. If not, probably you have to add this also in your system and try to contact those institutions to interview them. Next. Yeah, I think I will hand over to Daniel from here. Thanks.
Yeah, thank you so much, Malik. So we continue with the tools for the system assessment, and the situational, the context and the situation in the country, because at the end of the day, the SRS will come into a setting or an environment where there are other systems out there, and we want the SRS to be fully integrated in the mortality surveillance system of the country. And even though we don't want to improve the entire mortality surveillance of the country, but we really need to understand like how that surveillance system is set up so that we can properly integrate the sample registration system that you are planning. And the tools that Agbessi and Malick has presented, and the one that I'm going to present, are tools that we think that could help you in understanding the system and how the SRS could be integrated. But as Agbessi and Malick mentioned, they are not prescriptive. So these are just options that you can use. You can adapt them. We are here to support if you need support for adapting them. But these are options that we think could be useful. So coming to the tools, so continue looking at the stakeholders. We thought that this interest power grid for stakeholders would be useful for countries to do. I think in Zambia we started doing some of this. I saw some of the country teams already working on this, and basically we want to know like who is involved in mortality in the mortality surveillance system, who is recording, collecting, interested in mortality data. And then how much leverage do they have to support our efforts? And in that sense, you can create this 2x2 table where you have on the top left like institutions or people with high interest and low power, to the top left, to the top right, high interest and high power, low interest, low power, and low interest, high power. By doing this, you will identify, for example, actors that you need to really involve from the beginning so that they are on board with the idea. And there are some other actors that you may want to inform and to keep in the loop, but maybe not so closely. So it will help you also to make efficient investments in how to engage with institutions, with people in country, depending on how close or far are with you in in the mortality surveillance in the country. There is a one pager in the folder where we describe like a how to do this. Basically, it's a super simple exercise, and could be done either with the desk review that Malick was mentioning, or even like similar to what he was suggesting, like as part of those interviews, trying to understand these interest and power dimensions of the different stakeholders that you're gonna be mapping out. You go to the next. So the previous one was who is who, and this one is around how information flows in the existing system. And this is an example of the information system in Ghana that actually was done by Sarah, that I saw her in the meeting room today. We did it with the Ghana Statistical Service and the team there. And it's trying to show which mortality information is being collected, where, and where is it sent. So with this type of diagram, you can identify like where are like hubs of information for your mortality surveillance system, where you can anchor the SRS, and where the information from the SRS should go once you have a super nice sample registration system up and running. So in terms of integrating in existing system, this is kind of essential, trying to understand what we call the information architecture. And again, this is not kind of rocket science. We are using social network analysis to do this type of diagram, but the type of information is similar to the one that Malick was presenting a couple of slides ago. So it's not a lot of information what we need, but then you can use these visualizations to trigger discussions. Many of these tools, as we see them, is these are tools that are useful for collecting information, but then to have informed discussions about either the plans or the sample or the cost or the governance. So these different tools will give you different ideas on how the SRS system should be designed and the cost of it. If you go to the next one, please. And then the last one that we want to present, and personally I think is super useful for this type of analysis, is process analysis, process mapping. I think almost all countries who has received a planning grant, they have experience with process mapping, and I find this tool very useful, not only to map out who is doing what and how the information flows, but also to bring people together. So I've done like many process mapping workshops, and in those workshops, if you have these maps developed in advance, you can trigger very interesting discussions on where the information is going to come from, how the information is going to end in the right place, who has the databases, how can we access this, where are the silos, how can we connect this or that, and those discussions are super important for an SRS design. So this exercise doesn't take much. So probably from the interview guide that Malick was presented, you can probably develop the first draft of the process map. You see that for Ghana, there are like many process maps that definitely we can share, and I'm sure that the teams, they have even more. So there are process maps done probably for all countries. You can adapt them, and then you can use them in, for example, a workshop to facilitate a discussion on, okay, now that we have this system, how the SRS will be anchored in the mortality surveillance system. Like what are the steps and who is gonna do what? I think for those discussions, process mapping is super useful. If you go to the next. So then how do we think this could be done? And this really depends on you. So we are here to support, to provide technical support in the tools or the setup. But we don't think that it will require like a big heavy lifting on the team side to do, for example, the data collection or to do the initial round of data collection. And we thought that with a couple of researchers that could collect some of the data, that for these researchers, some training could be done to familiarize with the tools and the procedures, and then like choosing like the right, like appropriate tools for the country setup, either digital or paper or depending on the digital solution like ODK or Copo tool. So it depends on what you think is useful for you. And then some of the products are like the process maps. That's kind of more standard, where you have a standard way to putting it in on paper and to develop the process maps. And by doing the process maps, you are already collecting data at the same time. But anyway, but this is just ideas of what you could do for data collection. But it's really up to the teams in countries to decide, okay, I want to use this tool, and this tool in this way, and then I plan my both data collection, analysis, and dissemination in this way. And we are here. We can be there to help you and to support with whatever you need. But it's really up to you to decide what tools, how you use it, and then what is it? What is the actual process? If you go to the next one. So then, in terms of the analysis, so some of the analysis that you could do, so you could look at the legal framework, for example, for mortality and cause of death surveillance. What are the priorities in the country? Hopefully, you have a clear view of who is who, like the stakeholder analysis, with interest power grid or not, but you know, like who should be involved, how is the governance, how should we move ahead after the planning grant is completed. Ideally, you would have an idea of what are the information flows for mortality in the country and how SRS will be connected to those information flows. Also, business process mapping, in the sense that understanding the business architecture of the system, and how SRS will complement that architecture and will be anchored in that architecture. And then finally, having an idea of what would be the digital solutions that you will use, because it's not only about who is doing what, and the information is also which platform will be used. What are the existing platforms, like the existing software and applications that exist in the country, and how the SRS setup will complement those and will integrate with those or interoperate with those. You go to the next. So then, as of next steps, and this is the last slide from our side, and we will open for a discussion or questions. As Sam was saying at the beginning, there will be a series of virtual sessions like this one. We know that this is a lot of information for one day. We are planning to unpack this into specific sessions for specific tools that will go through the year. We were thinking that so there's the idea of having an in-person meeting at some point in April, May. The idea is that countries with a planning grant we will work on your preliminary findings of the situational assessment during that workshop, in addition to many other things, but that will be a key element of that workshop. So between now and April, May, hopefully all the country teams will not only set up and design the situational assessment plan, but also implement it. So we would have something to discuss in the in-person workshop. As I was saying, there will be technical assistance provided if requested by the team, if it's needed by the team. All this, the webinar and all the tools and the how-to and the interview guides are already in the Dropbox folder. And this meeting will be also stored there, so you can go back, share it with the team or with whoever you think would be interested. And yeah, there will be our next webinar will be in March, and stay tuned. And I think with this, I give it back to you, Sam.
Thank you so much, Daniel. I just want to acknowledge that between what yourself, what Agbessi and Malick have covered, this is an immense amount of information for one just essentially 45-minute session. And so I just want to reiterate that first, you should feel free to reach out to any of us if you have questions, want to kind of further engage with us around how to implement these tools in your country. The second thing I want to reiterate is that these are suggestions. I think Daniel had mentioned, and Agbessi had mentioned, these are tools that can be adapted for your own uses. We are not expecting you to fill in these forms exactly using these templates. They are really just supposed to be guidance documents to ensure that you are collecting kind of comprehensive information in order to inform how your SRS can be designed. So just to stress that we just wanted to provide these as guidance documents, but if you want to fulfill them exactly as written, that is completely fine. You don't need to do I mean, ideally you make sure that they're adapted for your country, but you can use them as is, or you can edit them extensively. So I am going to see if anyone has any questions around what content has been presented, but I also want to ask if anyone, if our colleagues from Zambia or Mozambique, I think I have seen on the line, Nigeria, if you want to chime in and just and express how you've used or have not used these tools and what's been helpful to you. So with that, I open up the floor, and if people could, I believe, raise their hand or put their question in the chat, then we will be able to kind of facilitate your questions from there. I think that's Stephen. Please go ahead.
Thank you so much, Sam, and greetings to everyone on the call. Thank you so much for the wonderful presentations and going through the tools that have been used for the assessment. I think those really helped us through our assessment period. But I think one best case practice that we had was ensuring that members of that committee or the group of people who are actively coordinating the planning, that interministerial or interinstitutional group, is actively involved in the data collection, in the desk reviews, and in the interviews in the field. I think that really helped us learn to work together across the different ministries and really sets the pace for future collaborations. So just a best practice. Over.
Thanks so much, Stephen. I appreciate you sharing that. Ronald, I see your hand up. Please go ahead.
Okay, thank you, Samantha, and thank you to the team for this presentation. This definitely is a really good guide to those countries that will be doing the implementation. Whilst the team has done really well in expanding on the needs assessment, fit assessment, of course, it's important to assess what the country has in terms of the resources, the readiness to implement, and of course, the capacity as well to implement. Because definitely when you bring in or call in your stakeholders, they will most likely ask you what you have at hand before they can actually tell you what they can bring in. I want to, well, I mean, I see you've got a lot of tools. I mean, the good thing about implementation is that we walk through a lot of tools before we can be able to get things done. But it's important that it's not highly overexpansive, and it doesn't really well, scare people in terms of getting information or doing thorough assessment at the start. So I'm happy you said that it can be adopted and adapted to fit the context, because we are looking at many countries or multiple countries here. And so there could be variance in terms of barriers and facilitators. So it's important that countries know that these tools are not the be-all and end-all, but then can be adapted. But then the core components should be followed. And lastly, I want to talk about the interest power grid. The area where you have the high interest and high power people is very key. Clearly, of course, you have a lot of agencies pulling together death mortality data. So it means you will have high interest, high power people like the Minister of Health, Minister of Information, of course, your NCRE, your statistics and all that. I have seen a lot of power play at the start. It's nice when you talk about working, having your interministerial committee and all that. But then there has to be a lead implementer. And the lead implementer most likely would want to groups need to control the resources. So there will be power play. So it's important that the various countries know that you're going to battle with this at the start. And it's better you think hard how it's going to play out in various countries. Over.
Thanks, Ronald. And I'll just add, for those of you who don't know, Ronald has helped to build the SRS in Sierra Leone. So he has a lot of experience in this area. I see Evalda's hand and then Daniel. Daniel, are you responding to Ronald?
Yes, a quick response. So, because it's true that, thank you for the comments. And And don't be scared about the number of tools. So many of these things that we have presented, they are really low-hanging fruits, and we can do kind of economies of scale in the sense that once you are out there, you look for the information on the stakeholders, on the processes, on the information. It's the way the way you plan it is what will make it burdensome or not, but it's not super burdensome for country teams, and we can help like navigate that to make efficient like investments of time or from the team, so to get the maximum output. Thank you.
Thanks, Daniel. All right, Evalda, over to you.
Thank you, Sam. Hi, everyone. This was very, very interesting, I think. And I think all the tools that Agbessi, Malick, and Daniel presented are very important. And I know that the perspective was mostly on making sure that we have the baseline. But for most of the tools that have been presented, such as the SRS assessment, even the business process management tool, I think it's important at some point to discuss for those countries that have already implementing those tools, how often should we update them? Because it's important to recognize that the countries have different they change a lot, especially when we're talking about the government and their roles. And I think it's important to keep track of the dynamics of the CRVS and mortality surveillance in all those countries, and making sure that we not only implement the tools, but we make sure that the stakeholders have access to them and they understand the robustness of the data that we can get with these tools and how can they be actually implemented. So I think this is one of the lessons learned from Mozambique, that we have implemented some of those tools, but it's still a challenge to make sure that everyone understands how important it is to know the information that these tools generate and how can we apply the CRVS and mortality surveillance perspective. Thank you.
Thank you so much, Evalda. Yeah, I think it's an important point that these are evolving tools. Systems are not static, they're dynamic, and organizations and systems change over time. So continuing to reassess is a good idea. All right, I see Agbessi and then Honorati.
Quickly, yeah, important point that were made. Just 2 points. First, the tool that we share, I hope you get a chance to look at them carefully. Send us feedback on these tools. If you, in terms of anything that you think that need to be added, or that is anything that is irrelevant, we're glad to keep these tools open and keep improving them. So send us a comment. The point about stakeholders is a critical one. I mean, the more stakeholders you have, the challenge it is to get things forward. Things get slow a bit. But it will urge you to keep focus on the objectives that we all are up to here, is to really ultimately come up with a plan for your SRS design. And so, it's critical based on the stakeholders' interests, where resources are going to come from, and all this challenge. Keep an eye on the deliverables that we ultimately need to come up with, which is developing a mortality surveillance systems that is based on the sample registration systems. Now, you may find at the end that, oh, yeah, well, this is irrelevant for the country completely. We want to know if that's the case as well and why. So it's important that, discussion happen, but keep this going and don't lose yourself within the crowd of stakeholders that might be available. Sorry, thanks. Over to you.
Thanks, Agbessi. Honorati, would you like to go?
Yes, thank you very much. And thank you very much for the presenters. Very comprehensive information that they've shared. I have a quick question to Cobos. He presented a few analysis tools, especially one on process mapping, and I think another one on business process architecture. Any suggestions on the software that he used or can be used? Thank you.
Yes, so super quickly. So we use, thank you, Narati, for the question. And we use Visagi because basically it's free and we can use it for that. But there are quite a few now. Like one is called Bonita. There are different tools that are like free to use to develop the process maps. The good thing about Visagi, the one thing that I like is that allows you to do some modeling. But if that's not the important for you, you can use just Visagi. But happy to connect further if there is a need.
Daniel, do you want to put the names of those software in the chat?
Yep, I'll do that.
Thank you. Okay, I'm not seeing any other questions or hands up here. Giving people one more minute. Not to put you on the spot, but Emily, are there any closing words you want to wrap us up with, or any other announcements to make with this group?
Can I just make few words before you close in 10
Oh, hi,
seconds?
Samba. Yeah,
Agbessi.
sure. Go ahead.
Yes. I just want to say that this has been one of the most um, interesting and productive initiatives, and this is so much in need in countries. And I'm very, very pleased and happy to see you taking into account some kind of baseline initial assessment in countries, because that would be almost close to zero. At least I know for many sub-Saharan African countries that this field is really, really a way among the neglected. So I really would like to thank you all for caring about this. After starting my rapid census already here in Mali through Rich Scale Up, that Agbessi is very much well aware, we are realizing that this is so useful. And some rural leaders are saying here already in villages that if we collect those data, they would love to know how much household they, how many household they have, how many person in every per household. We're just going to have their data, so they themselves they have to do their own economic and social business with that. So this will be absolutely very useful. And the National Direction of Health and the National Census Office, they are all working together with us. They are all very, very thrilled and happy. So this is something that Agbessi, we must do if we are going to save lives. Thank you again very much.
Thank you, Samba. Appreciate those words about the importance of this work, and I hope everyone else on this call. I know you all recognize that as well. So hence why I'm glad to see this large group come together to support this important initiative. All right, Emily, I think I saw you available and coming off mute. Do you want to add anything before we close? Okay. All right. Well, we'll let Emily chime in the chat if she has anything else. But thank you all for joining for this first session today. Ronald, yes, don't forget universities. Those are very important academic partners. They're probably too close for us to shout out in this type of forum because we work with them all the time. But yes, very, very good point. All right, we will be making all of the tools available on Dropbox. I have been having some issues giving everyone access to the Dropbox folder, but I hope we can work through that soon to make it more so it's easier for everyone to see the files. But please reach out to me in the meantime if you need access to anything specifically. With that, I want to thank our presenters today, Agbessi, Malick, and Daniel. Thank you so much for preparing these wonderful slides. And I think these will be great resources moving forward. So with that, look forward to our next webinar next month. And please let me know in the meantime if you have any specific questions or discussion topics that you'd want to make sure that we cover. Enjoy the rest of your day, everyone. Thank you.
Thank you. Bye.
Bye, everyone.
Thank you.
Thank you. Bye-bye.
Thank you.
Thank you, Daniel. One thing I would like to, if you don't mind, you were very good. There were also other presenters that were very good as well, but we have to remind them to go slowly when they're going through their presentation. Are you hearing me? Yeah, it's crucial. You speak wonderful, but it's very important because sometimes I'm looking at and translating the slides, which I already did, but the time to read the French is always longer, as you know.
Sorry about that.
No, I am so used, trust me, when I am in person, I'm by myself doing the whole day. I don't take any help from, really, I'm the only interpreter because I can't pick up from where the other person, I can't. I have to do it all. I am totally out of body experience, I call it, when I'm doing this. But when they go so fast, it's a challenge. So just a reminder before they start to speak a little bit slowlier, that will be awesome.
Okay, we will try.
I know. We always try. There are always in the regular webinar somebody that says, hey, slow down, please, for the interpreters. But I'm used to, but, and it went very well, but just a suggestion. But thank you so much. Thank you for sending me the link, and I wish you a great afternoon, I guess, right?
Yes.
You are, where are you right now?
I'm in Basel, in Switzerland.
Switzerland. Definitely afternoon. Thank you. I'm in Seattle, Washington, so the time frame.
And Moni, thank you so much for translating everything. Daniel, Moni spent the weekend translating all of the documents.
Day and night. I didn't sleep, literally. But I have a few questions for you, Samantha. If you can look, I had corrected form 1.3. If you can put it in the Dropbox and remove, it was one sentence that I didn't didn't translate for some reason. If you can replace it, that will help a lot. All those people are going to go in and use those French for the French speaking. So I want absolutely everybody to be everything will be perfect.
Yep.
I like perfect.
I'll go ahead and do that. Yeah.
Thank you so much. Have a great afternoon. Again, Danielle and Samantha, talk to you soon.
Sounds good. Thanks, Moni.
You're welcome.
And Daniel, you and I can figure out how to get the recording shared.
Yeah, I
think we have some file management to work on, but
yes, don't worry. I can set it up in the Swiss system, and then you can either download it and put it in the Dropbox or can be kept there. So whatever. I will need to do that because I cannot send it to you like by email or anything.
Okay. I'm going to look up some other options, get some more information about what we can and can't do. But that sounds good. Thank you. All right.
I'm going to close now.
Yeah, me too. All right. Enjoy your evening.
Bye-bye.
Bye.